When you hear someone from another country talk about the United States, they are always happy to travel to our country and say it's the best country to live in. With our country being the best country to live in, why is something as essential as healthcare considered as a luxury item? Healthcare has been a huge topic throughout many years in America. It has been a topic candidates for presidency use to get votes from different states. While some may find healthcare to be a privilege, many others, like myself, would oppose and say that it should be a right. Whether everyone should be entitled to proper health care and not be subject to being medically treated or not due to financial status has been an argument for over 100 years. This topic will not only affect me, but everyone who is a citizen in the U.S. Because just like me, everyone needs and wants to remain healthy. And if they aren't being helped, then how can they? I hope that by listening to my speech, you'll agree that healthcare is essential for everyone, regardless of income and affordability. To start off, I will talk about the United States having the worst healthcare system. Next, I will discuss the importance of healthcare and uninsured members. And lastly, I will cover the solution to change healthcare problems. Let me begin with the United States healthcare system. With our country being so rich and a country that helps build other nations, it is sad that we as citizens are penalized on who benefits from healthcare. Depending on money, that's sad. With this situation, it brings us to the true question: is healthcare truly a right? According to Anna Shah's web-based article, Healthcare Around the World, the United States has one of the worst healthcare systems in the world. And as far as industrialized countries, we are the only country without a universal healthcare system. And our citizenship does not include healthcare as a right. In the United States, we receive our healthcare insurance through an employer, or we purchase our own healthcare insurance that usually includes high premiums and outrageous bills. Many think that cost shifting has reduced the cost of insurance. Cost shifting occurs when a hospital or other healthcare providers charges an insured patient more than it does an uninsured patient for the same procedure or service. Although some may think that the idea of cost shifting is a good idea, I would oppose and say that it actually makes it harder to pay for the healthcare insurance and does nothing to reduce the payment of healthcare. According to Victor Fuchs' web-based article published in 2009, cost shifting does not reduce the cost of healthcare. The United States has been subsidizing the rest of the world by allowing the drug companies to practice price discrimination by charging higher prices in the United States than any other country for the same drug. Now that we have an understanding as to why the U.S. has the worst healthcare system, I will proceed to the importance of healthcare and the amount of uninsured Americans. Even if you are in good health, having health insurance is important. You never know when your family member or even yourself may become sick. Having good health insurance provides you with a way to get medical care when you need it. Emergency rooms are open all day and any time of the week. They allow you to come in without any co-payment or an appointment. With healthcare being such a big importance to life, there are many who do not have health insurance. According to the United Nations Population Division, Department of Economic and Social Affairs in the 2006 revision, over 47 million non-elderly Americans were uninsured in 2012. According to procon.org, Right to Healthcare, published July 2015, in the United States, people are 33% less likely to have a regular doctor, 25% more likely to have unmet health needs, and over 50% more likely to not obtain needed medicines compared to the Canadian counterparts who have a universal right to healthcare. The bottom line is that healthcare is the most valued asset. With a good health insurance plan, you help protect the health and financial future of you and your family for a lifetime. With the new ways to get affordable health insurance, it makes sense just to get covered. There were about 11 million uninsured working age Americans with chronic illnesses such as heart disease and diabetes, and their lack of insurance was associated with less access to care, early disability, and even death. Now that you know the importance of healthcare, it brings me to what we can do about this problem. If the government rule out the cost of Medicare and healthcare out, then our death rates around the world will go down. Everyone should be able to be healed when they are sick because of the simple fact we can't control sickness. According to a quote from the web-based article published July 2015, Devex by Rose and Tim, it has taken an epidemic like Ebola to expose the gaps in the health priorities and stigma. While people in Libya were being left to fend for themselves on the street, Western aid workers and doctors were sent home for special treatments. Essentially, the poor were left to die. This quote should be an embarrassment to the world because it basically says that people are being left to die. If the government would have just free healthcare, more of us would be able to survive. In summary, the journey towards changing multiple things about healthcare has reached and is still reaching a historic milestone in epidemic proportions. Let me recap. I began explaining how the U.S. has one of the worst healthcare systems. Then I explained the importance of having healthcare. Following that, I brought up the solution, which was that all Americans should be granted free healthcare. I hope that many of you seek out to get health insurance for your family and yourself. I find that healthcare still hasn't become a right because it is not free. We as a nation have a long way to making healthcare a true right, and we must first start off by not letting people die off because they lack financial support. Thanks for listening.